and welcome to The Naked Truth. My name is Charmaine Picardo. Thank you for joining us for this special 5-episode series focusing on access to safe abortion as a human right and saving lives matters. This is part of the South-Aid's regional My Choice, Our Choice campaign, which focuses on ending unsafe abortion in the SADC region. The campaign is really contributing to a SADC region where adolescent girls and young women can access free from judgment, safe and legal abortion services with the support of our policy leaders, men and boys, as well as the larger community. When it comes to statistics on unsafe abortion, the numbers are so high and are alarming. An estimated 8 million unsafe abortions occur in the sub-Saharan region alone each year. And over 50% of these abortions are classified as unsafe. And in the SADC region, 14 countries have restrictive abortion laws, and this contributes to the burden of high maternal mortality and morbidity in the region. And where abortion services are legally provided, the cumbersome and practically unrealistic conditions that come with that also make it practically impossible for a lot of adolescent girls and young women to be able to access the services. These percentages, ratios, and the data presented are not just numbers. These are real people that have real lives, that have families. And to help us really understand this issue, we have Mrs. Edina Masiwa, who's the director of the Women's Action Group in Zimbabwe. Mrs. Masiwa is a seasoned leader, expert and advocate in the areas of sexual and reproductive health and rights, gender and women's rights. Mrs. Masiwa, welcome to The Naked Truth.
Thank you, and thank you for the opportunity.
Mrs. Masiwa, how serious really is the challenge of unsafe abortion in the SADC region and in the country in particular?
The problem of unsafe abortion is a real problem in the SADC region as well as in Zimbabwe. I want to start off by acknowledging that the SADC region has also put in place a strategy on sexual and reproductive health and rights. And in that strategy, they also highlight the challenge or the problem of unsafe abortions. And they also propose that the restrictive laws be also addressed. I want to come to Zimbabwe, for example. In 2016, there was a study which was done by Gatmaka Institute. This study revealed that more than 65,000 abortions occurred in Zimbabwe in that year only, and most of the abortions were unsafe. So there is evidence through research that shows that we have a problem of unsafe abortions in the country. And I also want to say the 65,000 could be just the tip of the iceberg, because there are so many unsafe abortions happening and these go unreported. So really, it is a problem. And as a region, I think we should start working on that and having solutions to that problem.
My Masiwa, the statistics that you're presenting, for example, the 16,000, right?
65,000.
The 65,000 abortions, that's a lot, really, when we think about it. Mm-hmm. So those numbers are large. They are very compelling. And if we look at the SADC region, even putting in place the sexual and reproductive health and rights strategy, but why are we still then experiencing underreporting and sometimes no data at all?
I think the main reason is people have just took it that abortion is illegal. They don't even understand that abortion is restricted. So there are times when you see even those who are eligible to get safe abortions under the law, they don't report cases of rape. They don't report cases of incest, but they go out there and have unsafe abortions. So I think it's the stigma and the fact that abortion has always been a taboo subject to talk about. Because whenever you talk about abortion, people look at you and wonder what you are talking about. So these are the reasons why some of these abortions go unreported. Also, through the same study which I mentioned, the Guttmacher study, it was also found out that about 40% of the unsafe abortions have complications, but some complications resolve on their own, but you could end up having challenges like infertility. But when you abort, you don't have, when you have the complications, they will resolve on their own. You might not need hospitalization. And that way, those cases are sometimes not captured by the health delivery systems in the region. So yes, these are the challenges we also see. But we are also looking at our people. I think they are just putting their heads in the sand and pretending that no abortions are taking place. But in reality, I'm sure all the people know at least one person who has had an unsafe abortion, but they don't want to talk about it. So I'm really pleased that we have started talking about access to safe abortion, and we also are promoting that abortion is healthcare. So when we talk about healthcare, we also have to think about abortion services. I also want to highlight that for Zimbabwe, we have a post-abortion care program. And when we look at that program, it's sort of allowing women to have abortions outside the health institutions. And then they come in and clean up what will have happened. And we also have found out that it's more expensive to treat someone for post-abortion as compared to offering people safe abortion. So I'm sure we are also not looking at the implications of unsafe abortions with an economic eye, which I think we should start doing now, because it's more expensive to treat someone who has had an unsafe abortion than offering them a safe abortion.
Okay, thank you, Mama. So just two things quickly when you were speaking that really jumped out for me. The first issue, there are some circumstances within the restrictions that allow you to obtain a safe abortion. But is this easy? How easy is it then to walk into a health facility, for example, in a case of rape or incest, for a woman or for a girl to access the services? And just secondly, you're speaking of us knowing someone who's had, unfortunately, to resort to having an unsafe abortion. But who are these women? Who are these girls?
Okay, I'll start by responding to your first question, where you are asking whether it's easy just to walk in and say, I've been raped, I would like a termination of pregnancy. It's not that easy. We always have talked about the cumbersome administrative processes that come with the quest to have a safe abortion. To start with, when someone is raped, so much goes around their heads. And what we are finding out is people do not report on time. Because if you report rape in time, then you can have emergency contraception. You can have post-exposure prophylaxis. But what we have found out working out there in the communities, women only report rape when they find that they are pregnant. And it depends on where they are. If they are in the rural areas, it might also take time and resources. There are some hidden costs to accessing safe abortion. One has to travel. They have to pay for bus fare as they come to get the service. And when they go to report to the police, they also have to go to the courts where the magistrate has also to issue a certificate to terminate. So we have noted that there are so many challenges along the way, because sometimes the magistrate might also order an ultrasound scan. which is not easily available at community level. And at times, women have to pay for the ultrasound scan. And by the time they go back to the courts, weeks might have elapsed, and they might be asked to then again go for another ultrasound scan. So we have found that there are so many administrative processes that also hinder the easy access, even though abortion is allowed where there has been rape. Coming to the case of incest, incest is within the family. So the family also has to agree on a way forward. If it's a young girl, some people might say we are not reporting this because maybe the perpetrator is the breadwinner. So these are realities which are faced by women at community level when it comes to access to safe abortion.
Okay, thank you very much, Mai Masiwa. Join us after the break. Welcome back. Today we are discussing the issue of access to safe abortion services, particularly looking at how the restrictions that we have are currently hindering access to safe abortion and end up indirectly promoting unsafe abortion. I'm joined by Mrs. Masiwa, the director of the Women's Action Group in Zimbabwe. Mrs. Masiwa, before the break, you started to talk about families, and I remember I'd asked you, who are these women and girls when we look at the percentages of the people that we know that have had to resort to unsafe abortion?
Thank you. As I said earlier on, abortion is affecting every woman. Unsafe abortions are affecting every woman. But out there, we always think it's the young girls. But research has shown that even married women resort to unsafe abortions for the reasons best known to them. We also have had experiences where students at universities also have unsafe abortions. So there's this feeling that it's only the young people, but what we have seen is all the women at one stage, most of the women at one stage might need safe abortion services. As I said, in Zimbabwe in 2016, 665 women were pregnant. But of all those pregnant women, 40% were unintended pregnancies. So that really shows that there are times when women just find themselves pregnant and they need a service.
Mm-hmm. So then how are the policy restrictions, so just going back to what you've said, it's affecting every woman. Mm-hmm. So how are then the policy restrictions, affecting or impacting on the health, on efforts to safeguard the health and the well-being of women and girls?
I think I will take the example of Zimbabwe, where we are using the Termination of Pregnancy Act that was enacted in 1977. That's so many years back. And when we look at that act, it's not speaking to the current situation where women are facing different challenges as well. And when we look critically at that act, it didn't serve the ordinary woman because it talks of 2 doctors should agree that the woman requires a termination. But out there in Murambinda, how many doctors do we have? Out there in Mbiri, how many doctors do we have? So this law I think it's restrictive, and it also doesn't serve its purpose. As I talked about the processes that are also involved, they also affect access to safe abortion for women.
So you keep giving the example of Zimbabwe, Masiwa, and we know that the government of Zimbabwe, amongst other governments in the SADC region, have put in place efforts to address maternal mortality and morbidity. But how has then the limited focus on unsafe abortion affected, the efforts that they're putting in place?
Yes, I think there are policies, there are strategies that have been put to also contribute to the reduction of maternal mortality in Zimbabwe. But as the example I gave earlier on, that we have a post-abortion care program, which is more expensive compared to a safe abortion being offered. So these policies are not responding to the needs on the ground. And one thing, Charmaine, which we should also bear in mind, when a woman decides they don't want a pregnancy, when they decide they don't want a pregnancy, they'll find a way of removing that pregnancy. It might be safe abortion through private doctors. We all know that is happening. Or it might be unsafe abortion through clandestine means, where they insert different objects, herbs, coat hangers, knitting needles in the cervix. So we also must look at that evidence and see how best we can save the lives of women if we are really serious about reducing maternal mortality.
And rightly so, Masiwa, the evidence on the ground points to us, needing to strengthen interventions, whether it's through reforming the policy or looking at strengthening service delivery. But just looking at the times that we are living in with the COVID-19 pandemic, how has this affected women and girls' access to safe abortion services and information?
Maybe when we look at how COVID-19 has affected access to services, one example that comes into mind is when there was a report through the Minister of Women Affairs that 5,000 girls fell pregnant during the COVID era. And during the first months of 2021, January and February, 5,000 girls. And of those 5,000 girls, I'm sure some sought unsafe abortions. So COVID has really affected access to abortion services. It also has affected the access to contraceptives. For example, the lockdowns which were put in place where women or where people had to have letters for them to travel from point A to B, that really affected access to services for women and girls. And this has really had a bad impact in Zimbabwe. And I'm sure we will see the evidence when the researches or the demographic health survey is done, because it's done every 5 years. So COVID-19 has really affected access to sexual and reproductive health and rights services.
Okay, thank you very much, Masiwa. Some very compelling evidence being shared by Mrs. Masiwa. Join us after the break.
At 16, Alice was not ready to have sex with her boyfriend, but because she wanted to stay together, she found it hard to say no when he pressured her. She asked her healthcare provider for contraceptives, as the law allows, but was shamed for having sex and was turned away. Later that year, Alice became pregnant. Alice was not ready to be a mother, and because she was afraid of being judged and turned away again, she sought the help of a stranger who said he could help. Alice had an unsafe abortion and became very sick afterward. The doctors later told her she almost lost her life. Alice isn't alone. Thousands of adolescent girls and young women like her may find themselves seeking unsafe abortions, accounting for over 10% of maternal deaths. Why? Some, like Alice, face stigma and judgment from healthcare providers, family, or friends. Many don't have access to sexual and reproductive health services, including contraception. Some are survivors of sexual assault or have abusive partners. Some never received comprehensive sexuality education, and when reproductive health care, including safe abortion services, are difficult to access, it puts their lives in danger. Alice's story shows how unsafe abortions are dangerous and can be deadly. Her story didn't end in tragedy, but many others do. Providing access to safe abortions is how we as a community put the lives and well-being of our sisters, mothers, and daughters first. Policymakers must be proactive and change restrictive abortion laws to save lives. To learn more, visit safaids.net. My choice, our choice.
Welcome back, and thank you for joining us as we unpack the serious issue of promoting access to safe abortion as a human right and trying to save the lives of adolescent girls and young women. Mai Masiwa, thank you very much for joining us once again.
Thank you.
So from what you've been discussing with us, Mai Masiwa, it seems a lot is happening on the ground. But what can we do to ensure that we bring to the fore the realities, the lived realities of adolescent girls and young women?
I think we should continue to share the stories of women who have had unsafe abortion. But the challenge sometimes there is, because it's criminalized, no one is willing to come to the fore with their stories. But I think we should go out there, collect the stories, and document them for evidence as we talk about reviewing of the termination of the Pregnancy Act.
So just looking at the answer that you've given me, what else is missing from the advocacy initiatives as well as responses from our respective leaders?
I think we now have all the evidence that is there, but now we need the political will to push the agenda forward. What are we proposing? We are proposing maybe a review of those cumbersome processes, administrative processes to access to safe abortion. We also need information out there to communities so that they understand that there's already the Termination of Pregnancy Act that allows for women who have been raped or who have had incest, or those with health reasons to access safe abortion. We also have to talk about the post-abortion care program, because we are having women die at community level because they have not gone to the hospitals, to the health institutions for the service of post-abortion care. So we need to raise that awareness, that you can have post-abortion care, no questions asked.
And just lastly, what is your call to action for our leaders in Zimbabwe as well as overall in the SADC region?
I think my call to action is that the Termination of Pregnancy Act of 1977 needs to be reviewed. We also need to review the conditions where safe abortion is allowed, as well as offer abortion to those who need it. I think let's liberalize the law. I know people out there will think it's not the best, but I think it will help reduce maternal mortality and offer health care to women and girls.
Thank you very much for joining us, Mrs. Masiwa. It's been a pleasure having you, and also just learning from some of the things that are happening on the ground, particularly when it comes to the lived realities of adolescent girls and young women. And thank you for the call to action to our leaders. Just as Mai Masiwa has said, reviewing the laws will save lives. Let's all come together, join this call to action, and see what we can do differently. The question now is, what can we do differently to make sure that lives are not needlessly lost? There's a lot that we can do if we all come together. Join us for the next episode. This has been The Naked Truth. Access to safe abortion is a human right and saving lives matters. Brought to you by SAFAIDS in collaboration with the Bayete Development Institute as part of the SAFAIDS My Choice, Our Choice campaign. on ending unsafe abortion in the SADC region. Let's join hands. Let's come together. Saving lives matters. Join us for the next episode.